your health. By Mr. Sandeep Wankhede, yoga teacher at Lal Bahadur Shastri Center for Indian Culture, Embassy of India in Tashkent, Uzbekistan. Health is the need of the hour. It is something we are all looking for and trying to attain. According to the World Health Organization, health is a state of well-being on a physical, mental, emotional, social, and spiritual level. Ahara, or the right food, Vihara, proper relaxation, Achara, right conduct, Vichara, right thinking, put you onto this path of good health. As the Bhagavad Gita states, Samatvam yoga uchyate, yoga is balance or harmony. And to get maximum benefits from this ancient Indian spiritual discipline, every practitioner must approach yogic practices with the right attitude. It is tailor-made to each individual, whether young or old, according to one's physical nature. So welcome to Yoga for Your Health at Lal Bahadur Shastri Center for Indian Culture, Embassy of India in Tashkent, Uzbekistan. Lal Bahadur Shastri Center for Indian Culture in Tashkent provides yoga classes at evening and morning hours, certificate courses on yoga and diploma courses on yoga under the guidance of the yoga teacher Mr. Sandeep Wankhede, free of charge for a healthy and happy way of living. Literally speaking, the word yoga comes from the Sanskrit word yuj, which means to unite. It also means samadhi or absorption and samyama or judicious control. Ashtanga yoga literally means eight-limbed yoga, which is yama, niyama, asana, pranayama, pratyahara, dharana, dhyana, and samadhi. Maharishi Patanjali, the codifier of yoga, has described it as Yoga Chitta Vritti Nirodha, which basically means yoga is the cessation of fluctuations in the mind or control over the functional modifications of consciousness. The Hatha Yoga school became popular due to its efficacy in curing day-to-day health problems. What you learn today are the three important components of yoga that can be implemented in daily life: asana, pranayama, and dhyana, along with shuddhi kriyas and bandhas and mudras. Yoga allows you to enter the deeper aspect of your personality, which is essentially Sat, Chit, Ananda, or truth, consciousness, and bliss. A healthy person is one who enjoys these five aspects: a light and flexible body, a calm and quiet mind, control over the emotions, action in relaxation, and blissful awareness. Here are some general instructions for practicing yogasanas. Yogasanas can be performed morning and evening time. Yogasanas can be performed before or after bath, but allow half an hour between asanas and bath. Use a yoga mat. The room for practice should be well ventilated. Wear comfortable sport dress. Do not perform asanas immediately after meals. Leave 4 hours after a heavy meal and at least 2 hours after a light meal. Avoid stimulating drinks. Asanas postures and physical exercises should not be combined. Relaxing the body in a final posture is very important. Give a gap between each asana. Do not overexert beyond your capacity to maintain the postures for long durations. Adjust the timings according to your progress. So let's get started. Let's go from stressed out to relaxed. Sit in any comfortable position, take a deep breath, gently close your eyes and relax your whole body. Prepare your mind and body for the yoga practice. Before practicing any asana or yogic practice, you should perform the internal cleansing processes of Shuddhi Kriya. Vamandauti, Sutraneti, Jalaneti, Kapalbhati and Nauli. The first one is Vamandauti. We cleanse our stomach with the help of water. Step 1 is to get a jar of lukewarm water. Sit in Kagasana. Start drinking lukewarm water, slowly filling your stomach to its utmost capacity. Vamanadauti clears your skin pores, gets rid of pimples and boils, and it's useful in curing chest diseases, constipation, indigestion, cough, asthma, and tonsillitis. Once you feel a vomiting sensation, stand up and bend forward. Place your left hand on your stomach and insert your index, middle, and the third finger of your right hand into your mouth. Use these fingers to tickle the uvula hanging at the back of your mouth and throw out the water from your stomach. If any water remains in your stomach, repeat the procedure using your fingers to draw out the water completely. If you're suffering from heart disease, high blood pressure or peptic ulcer, do not perform this technique without expert guidance. Now we'll do Sutraneti. Step 1. Sit in Kagasana. Now slowly push the sutra or rubber catheter into whichever nostril is more active at the moment. Use both hands to push the thin rope through. When the cord goes through your throat, put your index and middle fingers into your mouth. Catch hold of the cord and draw it out through the mouth. Gently pull this cord up and down 6 times. Then gradually draw it out through the mouth. Now do the same with the other nostril. This will keep you from all nasal, ear and tooth infections. By way of precaution, pour a couple of drops of warm butter into each nostril after an hour passes by. And now we come to Jalaneti. Take a Jalaneti pot or a small teapot with half a liter capacity. Fill it up with lukewarm water and add a teaspoon of salt. Sit in Kagasana, holding the pot in the palm of your hand. Insert the spout in one nostril and bend your head in the direction of your other nostril. Empty half the pot of water into one nostril. While doing Jalaneti, breathe through your mouth. This practice is an excellent remedy for diseases inflicting organs from the neck upwards like chronic headaches, insomnia, drowsiness, nasal area infections, coughs, eye problems and impaired hearing. And now do the same with the other nostril. After completing this practice, stand up and bend forward at a 90-degree angle. Breathe out sharply while inhaling automatically through the nose, while moving your head towards the left, right, up and down. This will help you eliminate any remaining water. Let us begin with another wonderful cleansing process, Kapalabhati. Kapal means skull and Bhati means to shine. Sit in any comfortable sitting posture. Close your eyes, relax your whole body. Inhale deeply and start exhaling rapidly and forcefully. Your abdominal muscles should go in while exhaling. Stop when you start feeling tired and breathe normally. Exhale and relax. Maintain 120 strokes per minute. Kapalabhati is a wonderful practice. It forces out toxins like carbon dioxide from the body. It even tones up the heart and activates the respiratory and digestive systems, improving coordination between all the systems of the body. A quick word of warning: if you suffer from high blood pressure or heart disease, avoid doing Kapalabhati. And now Nauli is largely a process in which the abdominal muscles are made to move vertically, laterally in a surging motion, cleansing the body of impurities. Stand in position. Now bend forward slightly and turn your stomach swiftly from left to right and right to left. When you rotate your stomach, the central muscle of the abdominal wall becomes concave and it goes in. Nauli is considered as the foremost amongst all the Shuddhi kriyas, or cleansing processes. It affects practically all the functions of the body and keeps your insides clean. If you have stomach ulcer, high BP or heart disease, don't practice it. Surya Namaskar. Surya Namaskar means sun salutation. It comprises of 12 positions which improve flexibility of the spine, reduce abdominal fat and improve the respiratory, nervous, digestive and endocrine system.
Ravaye Namah. Suryaya Namah. Bhanave Namah. Khagaya Namah. Pushne Namah. Hiranyagarbhaya Namah. Mariche Namah. Savitre Namah. Adityaya Namah. Arkaya Namah. Bhaskaraya Namah. Shri Savitra Surya Narayanaya Namah.
This is considered as one round of Surya Namaskar. Now that your body is warmed up, you can soon perform the asanas. Asanas are basically the third step of Ashtanga Yoga. We will first do the standing postures. They are whole body postures that give strength and flexibility. They give your body sense of balance and build up stamina. They improve blood circulation, leaving you invigorated and refreshed. Our first posture is Tadasana. Start by standing with your feet together. Inhale deeply and raise your arms up towards the sky, palms facing each other. Now lift your body upwards while standing on your toes. Try to give yourself a good stretch from fingers to toes. Then come down on your feet, putting down your arms and relax. Ardha Chakrasana. Stand with your feet together, hands by the sides. While inhaling, slowly raise your right arm up to the shoulder level. Turn the palm upwards. Continue raising it until the biceps touches the ear. Exhale and slowly bend to the left. Hold it up to your capacity and slowly, step by step, come back. Do the same with the other side. This asana stretches side muscles and eliminates fat from the abdomen. It releases back pains and cures liver problems. Now we're going to do Chakrasana 1. Stand with your feet about 1 foot apart, then raise your hands up to the shoulder level. Rotate your upper body to the right and put your left hand on the right shoulder, your right hand gently embracing the waist from behind. Breathe normally while holding this posture. Return and repeat it to the opposite direction. This asana turns up the waist, back, and hips. It also eliminates stiffness in the back and removes fat around the waist. Our next asana is Chakrasana 2. Stand with your legs shoulder width apart. On an inhalation, raise your arms and make a finger lock, palms facing upwards. While exhaling, bend forward at a 90-degree angle and turn to the right. Maintain the pose as long as you can. Then come back and turn to the left. This posture strengthens the neck, shoulders, abdomen, back, and thighs. Now slowly come back, step by step, and relax. Now we're doing Konasana. Kona means angle. Take your standing position. Open your legs about 1 meter apart. Raise your arms up to the shoulder level and bend forward to a 90-degree angle. Then put the right palm on the ground near the right foot. Hold it up to your capacity. Slowly come back while exhaling and do the same with the opposite side. This practice will make your spine flexible and it will relieve back pains. But those who suffer from cervical and lumbar spondylitis and hypertension should not practice it. Now we are going to perform Trikonasana. Trikonasana means triangle pose. Stand straight, open your legs about 1 meter apart, raise your arms up to the shoulder level, exhale and bend forward at a 90-degree angle, then put the right palm on the ground near the left foot. Hold the pose to your capacity. Slowly come back while exhaling and do the same with the opposite side. Practice of this posture will make your spine flexible and it will relieve back pains. Those who suffer from cervical and lumbar spondylitis and also from hypertension should not practice it. Parshva Konasana. Put your legs about 1 meter apart. Raise your arms up to the shoulder level and while exhaling bend the right leg and place the right hand on the floor behind the foot. Maintain the asana as long as you can. And after that slowly come back. Do the same with the opposite side. This asana strengthens legs, arms and shoulders. It stretches the side muscles. And it's also beneficial for the spine. If you have any back or thigh problems, you shouldn't practice it. Parshvottanasana. Put your left leg about 1 meter backwards. Make the Namaskar mudra behind your back. Inhale and while exhaling bend towards the right leg, touching the knee with the chin or forehead. Maintain the asana as long as you can. After that, come back to the starting position and repeat it to the other side. This asana is good for leg, shoulder and back muscles. It stretches and makes the spine flexible. If you have any back or hip traumas or sciatic nerve inflammation, you should not practice it. And now we've come to Ardha Chakrasana. Please take your standing position with your hands by the side of your thighs. Look straight ahead and open your legs about 1 foot. Hold your waist with your hands. Now inhale and slowly bend backwards. Hold the posture for as long as you can. After this, exhale and bend forward. This posture removes fat from all sides of the body. It strengthens the abdominal muscles while regularizing digestion. It also improves flexibility of the spine, ridding oneself of back and neck pain. Avoid this asana if you suffer from spondylitis, heart disease and hernia. Now we're going to do Virabhadrasana. Put your left leg about 1 meter backwards. While inhaling, raise your both arms above your head, palms touching each other. Slightly bend backwards. Stay in the position a few seconds. Then, with an exhalation, lower your upper body forward and simultaneously lift up your left leg parallel to the floor. Keep it for 10 to 20 seconds. Then, come back. Now, you can repeat the same with the other leg. This posture strengthens your torso, abdomen, spine, arms and legs. It builds up concentration and sense of balance. Do not perform this asana if you suffer from high blood pressure or if you had any injuries. Ardha Chandrasana. Put your left leg about 1 meter aside. Turn the right foot 90 degrees to the left one. Raise your arms and while exhaling bend the right leg and comfortably place the right palm on the floor. Then slowly lift up your left leg parallel to the floor and raise your left arm over your head. Look upwards. Hold the pose up to your capacity. After returning to the initial position, Do the same with the other side. This posture strengthens your legs, abdomen, ankles, thighs, buttocks. It builds up coordination and sense of balance. You shouldn't practice it if you suffer from headaches, low blood pressure, insomnia or diarrhea. And now we'll do Natarajasana. Stand straight, bend the right leg and hold the right ankle with the right hand. Lift your left hand in front, then slowly pull the leg upwards as much as possible. Maintain this position for a few seconds and then slowly come back. This gives you a good stretch to the thigh muscles, shoulders, chest, abdomen. It strengthens legs and ankles. It improves blood circulation in the pelvic region. If you suffer from low blood pressure, do not perform the asana. Purna Chakrasana. Stand straight. Make a distance between legs. While inhaling, lift your arms and bend backwards, placing the palms on the ground. Then slowly move your hands towards the feet, trying to touch the heels. It's called Purna Chakrasana. Maintain it as long as you can, then slowly come back to the starting position. It strengthens arms, legs and torso, tones up internal organs and endocrine gland system. If you have stomach ulcer, do not perform the asana. Padahastasana. Stand upright with your back straight. Inhale and extend your hands upwards and bend backwards. Then, with an exhalation, bend forward from the waist. Place your hands on the floor parallel to the feet and try to touch your forehead to the knees. Padahastasana improves flexibility of the spine and it's beneficial for indigestion and joint pains. Bakasana. Take your standing position. Squat down with your feet apart. Place your palms on the floor at the distance of your shoulders. Then rise on your toes and lean your knees on the back side of your shoulders. Continue leaning forward until you're able to lift your feet off the ground. Keep this posture as long as you can. It will strengthen your arm, shoulder and abdominal muscles. It develops sense of balance and improves concentration. Do not practice it during menstruation and pregnancy. Also, those who have asthma, high or low blood pressure and heart problems should not perform the asana. Vrikshasana, the tree pose. Stand straight. Bend your right leg and place your right foot on your inner thigh, close to the groins. Put your hands in the Namaskar Mudra in front of your chest and keep balance. Remain in this posture for some time. Then release your hands, slowly put the leg down and repeat the asana with the other leg. This is an excellent balancing asana that stretches your chest, shoulders and groins and strengthens legs and spine. People suffering from headaches, insomnia, low or high BP should not practice it. And the next is Garudasana. Stand straight. Slightly bend your left leg and put your right leg over the left one. Place your right foot on the back side of the calf. Lift up your arms and cross them in front of your torso. Maintain it up to your capacity. Now release your arms and legs and repeat the posture with the opposite side. This asana improves your sense of balance and concentration. It strengthens and stretches ankles, calves, thighs, hips, shoulders and upper back. Avoid doing it if you have had any knee injuries. Supine asanas. These asanas stretch the spine and strengthen abdominal region. As you probably know, if your abdomen is not strong, you won't be able to do pranayama properly. First asana is Uttantadasana. Lie on your back, legs together. Raise your arms upwards and put them on the floor behind your head. On an exhalation, give a good stretch to the whole body. Maintain up to your capacity. Then release the tension and relax. You can repeat it 3 or 4 times. The stretching asana relaxes abdominal and pelvic muscles, and it is effective for increasing your height. Don't practice it if you suffer from lumbar lordosis and acute disc prolapses. Now we are going to do Makarasana 1. Lie down on your back, arms on the shoulder level. Put your right foot on the left knee. Then place your left hand on the right knee. While exhaling, turn your lower part of the body to the left and your head to the right. Stay in the pose 15 seconds. While inhaling, step by step, slowly come back. Do the same with the opposite side. Makarasana eliminates constipation and reduces stiffness of the spine. It's also helpful for diabetics. If you have stomach ulcer, do not practice the asana. Let's do Makarasana 2. Lie down on your back, arms on the shoulder level. While inhaling, raise your right leg up to a 90-degree angle. Then, on an exhalation, turn it towards the left side and put the foot on the ground. Simultaneously, turn your head to the right. Maintain the posture for 15 seconds and repeat it with the other leg. This asana is helpful for diabetes, for kidneys and stomach diseases. It strengthens liver and nervous system, eliminates constipation and stiffness of the spine. Don't perform it if you have stomach ulcer. Jatara Parivartasana. Lying on your back, put your arms on the shoulder level, palms facing upwards. Then lift up your legs at a 90-degree angle and move them to the right, and at the same time turn your head to the left. Your feet shouldn't touch the ground. Stay in the pose for 15 seconds, then repeat it to the opposite direction. This pose has a good effect on liver, spleen and pancreas. It decreases abdominal fat and removes pain in lower back. If you have stomach ulcer, you shouldn't perform the asana. Anantasana. First, lie on the left side of the body, resting your head on the right palm. Bend the left leg, take hold of the big toe. Exhale and stretch the right leg up towards the ceiling. Hold this position for some time. Come out of the pose and do the same with the opposite side. Anantasana is good for leg and back muscles, knee and hip joints. Avoid doing it if you've had any leg, hip or neck injuries. Ardha Pavana Muktasana and Pavana Muktasana. Begin by lying on your back. Raise your right leg at a 90-degree angle. Then bend it and interlock your fingers while holding the knee. Raise your upper body and try to touch your right knee with your chin or forehead. Hold for a few seconds. Then slowly lie down while exhaling. Then repeat the same with the left leg. Pavana Muktasana is a wind-relieving posture that takes care of constipation and indigestion. It also helps in correcting neuromuscular disorders. If you have stomach ulcer, you shouldn't practice it. Now you can do this asana with both legs. This is called Pavana Muktasana. Slowly, step by step, come back and relax. Naukasana 2 or the boat posture. Starting from supine position, slowly raise your legs, simultaneously raising the head and the trunk. Then stop at a 45-degree angle, your arms extending towards the toes. Hold for some time, and while returning, first place your trunk and head on the ground, then slowly bring down your legs and hands and lie on the ground as in the starting position. This asana is useful for those who have diabetes and dyspepsia. Those suffering from hypertension, heart disease and lumbar spondylitis should not practice it. Sarvangasana. Gradually lift your legs at a 30, 60 and 90-degree angle. Then lift your hips and back, your hands supporting your back. Keep your legs straight and look at your toes. Your weight should be resting on your shoulders and elbows. Maintain the pose for 30 seconds, then gently come down. This asana helps to get rid of dyspepsia, hernia, constipation and varicose veins. Don't do it if you suffer from heart diseases, high blood pressure or cervical spondylitis. Matsyasana, the fish pose. First, sit in Padmasana. Then slowly, with the help of your hands, lie down on the back. Put your hands on the floor next to your head. And lift the upper body, putting your head on the crown. Then grab the big toes with your fingers and pull them towards your head. Press your elbows on the ground and push your back upwards. Maintain up to your capacity. After that, slowly, step by step, return to the initial position. Matsyasana is known as elevate pain in the knees and back. It is good for those suffering from asthma, respiratory and diabetes. It activates the spinal column and stimulates facial nerves and blood vessels. We now move into Halasana or the plow pose. Lie on your back with your arms by your side. Slowly raise both legs, bring them to a 90-degree angle. Lift your buttocks and gradually lower your legs backwards and touch your toes to the ground. Put your palms on top of your head. Keep the posture as long as you can. The plow pose reduces backache by nourishing blood vessels of the spinal column and the back muscles. It also has a positive effect on thyroid gland. Please don't try this posture if you suffer from backache, cervical spondylitis, and sciatica problems. Chakrasana or the wheel pose. Lie down on your back, bring your feet close to your buttocks. Bend your legs and place your palms next to your shoulders. Lift up the middle part of your body up to your capacity and maintain the pose for some time. Then slowly return to the starting position. Chakrasana removes spine and waist pain, making it flexible, strengthens your biceps, calves and abdominal muscles. Those suffering from high blood pressure or spondylitis should not practice it. Karnapidasana. Gradually lift your legs at a 30, 60 and 90-degree angle. Then lift your hips and back and gradually lower your legs backwards, touching your toes to the ground. Bending your legs, bring the knees close to your ears. Then put your hands above the calves. Hold as long as you can and slowly return step by step. It is a good asana for stretching your lower back, shoulders and spine. It stimulates the abdominal organs as well as thyroid gland. Those who suffer from high blood pressure, asthma, heart-related problems or have shoulder, neck and back injuries should not practice this asana. Prone asanas. Let's take you through the prone postures now. These backward bends largely improve the spine flexibility and are great stress relievers. All the 5 regions of the back are given a good stretch: the cervical, thoracic, lumbar, sacral and coccyx. Keeping the prone position, we'll now do Bhujangasana, the cobra pose. Put your hands under your shoulders. Inhale and lift your head up to your navel region so that it resembles the hood of a cobra. Feel the stretch and expansion of your chest muscles. Hold this position and gently come back down. Place your forehead on the ground and relax your shoulders. Practicing this asana provides relief from backache and sciatica. It increases the flexibility of the back and massages the abdominal organs. The next posture is Shalabhasana. In this posture, your body looks like a grasshopper. Lie on your stomach with your chin on the floor. Make fists and put your hands under your thighs. Inhale slowly and raise your legs off the floor as high as possible. chin resting on the floor. Now remain in this posture while holding your breath. Then slowly come down while exhaling and rest. Besides stimulating the whole autonomic nervous system, Shalabhasana relaxes lower back pain and constipation. It is very good for asthmatics. People with high BP and heart disease should avoid the posture. Uttan Prishthasana. Lift your upper body and cross your arms in front of your chest. Then lift up the middle part of your body and lay your chest and forehead on the ground. Hold for some time. While exhaling, slowly come back step by step. This asana strengthens and turns up diaphragm, abdominal muscles and the entire back. Be careful if you have ever had any injuries. Naukasana. Legs together. Stretch your arms in front of you. While inhaling, lift your legs and arms up as high as possible. Maintain it up to your capacity. Then, on an exhalation, slowly come back and relax. Naukasana is beneficial for deformities of the spinal column. It expands chest and strengthens all muscles, and useful for those with diabetes and dyspepsia. Don't do it if you suffer from hypertension or lumbar spondylitis. And now we learn Dhanurasana, the bow pose. This is an excellent way to maintain the body structure. Bend your legs and take hold of your ankles with your hands. Inhale and stretch up slowly as much as possible. Your body will now take the shape of a bow. Maintain this position, then come down. This asana rejuvenates the small colon, giving a good stretch to the ligaments and muscles. It also releases gases from the stomach and relieves constipation and dyspepsia. It is beneficial for those suffering from sluggish liver, diabetes, back pain, and arthritis. Parshvadhanurasana. First we perform Dhanurasana. Bend your legs and take hold of your ankles with your hands. Inhale and stretch up slowly as much as possible. Stay in this position for a few seconds. Exhaling, roll on the right side. Hold it for some time and then return to Dhanurasana. Now do the same to the opposite side. While returning to the starting position, first lower your upper body, then release your legs. It will massage your abdominal organs, make the spine flexible and prevent displacement of vertebra. Those who suffer from hernia, hypertension and stomach ulcer don't practice it. And with that we've reached the next segment where we'll take you through the various sitting postures. They can be stretching, twisting, strengthening and giving pressure on the abdominal cavity. The first asana is Yoga Mudra in Vajrasana. Sit in Vajrasana. Make fists and place them on the lower abdomen. Deeply inhale and then, while exhaling, bend forward and put your forehead on the ground. Stay in the pose up to your capacity. This asana gives a good massage to the abdominal organs. It's also helpful in treating diabetes and flatulence. If you have a stomach ulcer, please don't perform the asana. Supta Vajrasana. First sit in Vajrasana and sit down on the floor between your legs. With the help of your elbows, slowly lie down on your back. Raise your arms over your head and place them on the floor. Maintain it for a few seconds. Then put your palms under the opposite shoulders. Hold the pose 30 seconds. Then slowly, step by step, return to the starting position. Its practice intensifies blood circulation in the abdominal cavity and corrects the spinal column. It's also good at treating diabetes, problems in the sacrum, and acute pain in the leg joints and spine. Bharadwajasana. In a sitting position, bend your right leg and place your foot close to your left thigh. Bend your left leg and bring it behind your back. Lift your arms up to the shoulder level. While exhaling, twist your upper body to the right. Put your right hand on the ground behind your back and the other hand on the right knee. Hold as long as possible. While inhaling, slowly come back and repeat to the other side. This pose stretches the back, shoulder, and abdominal muscles. It improves digestion and relieves back pains. You shouldn't practice it during menstruation, diarrhea, and headaches. Vakrasana. Sit with your legs together, stretched in front of you, hands by the side, palms on the floor. Bend your right leg and place the foot next to the left knee. Place your right hand behind your back, opposite the spine. Raise the left arm while inhaling and put the palm down on the floor. And twist backwards as much as possible. Keep the pose for some time, then return and do it with the other side. This asana removes constipation, flatulence, liver, and nervous weakness. It reduces rigidity of the spine, improves the functions of the abdominal organs. It's also good for treating kidney disorders. Vakrasana is not recommended to patients with hernia. Maricha-asana. Fold the right leg and place the foot close to the groins. Raise your right arm while inhaling. Then embrace the leg with the right arm and move the other arm behind your back, catching the right wrist with the left hand. Turn your head to the left. Breathe normally. Then return to the starting position and do the asana with the opposite side. It calms your brain, stretches your spine and shoulders, stimulates all abdominal organs. And there are some cautions for those who has asthma and diarrhea. Mandukasana. Sit in Vajrasana. Make a distance between your knees as much as possible. Raise your right arm and put the right hand on the opposite shoulder blade. Do the same with the other hand. Hold it for some time and slowly come back. This asana is helpful for breathing related problems. It stretches shoulders, arm and leg muscles. It relieves neck and back pains. Simhasana, or the lion pose. Sit in Vajrasana, bend forward, your palms on the ground, cross your feet and sit down on them, hands on the knees. Deeply inhale and open your mouth. Bring your tongue out as much as possible, trying to touch the chin with the tip of the tongue, and forcefully exhale. Maintain it for a few seconds. You can repeat Simhasana minimum 3 times. It improves blood circulation and exercising the whole neck area, effective for thyroid gland and tonsillitis. Marjarasana. Sit in Vajrasana, then place your palms on the floor shoulder width apart, the knees at the distance of your hips. Inhale and let the muscles of the trunk go down under the force of gravity. Curve your head and neck backward as far as possible. Then, exhaling, curve your back up like an arch. Draw the chin towards the chest. This is 1 round of Marjarasana. Repeat it 3-5 times. This will relieve tension in the cervical, thoracic and lumbar regions, invigorating the spinal nerves, and also improves the tone of the back, neck and abdominal muscles. Cautions for those who have had any back, wrist or neck injuries or chronic pains. Janu Shirshasana. First, sit in Dandasana. Fold your left leg and bring the right heel of the foot as close to your left groin as possible, the sole touching the inner thigh of the right leg. While inhaling, raise your arms over the head and on an exhalation bend forward. Catch hold of the big toe with your both hand fingers and pull it towards you. Lay your head on the right knee. Maintain it 10-20 minutes. Repeat the same with the other side. One of the most noticeable benefits of Janu Shirshasana is that it helps make the back as well as the hamstrings quite flexible. It helps stimulate the liver and the spleen. While performing the asana, make sure not to overstretch your muscles. The asana should not be practiced by those who are suffering from chronic or recent neck, back problem, high BP or heart problem. Paschimottanasana. This is a very important posture. Sit with your legs together, stretch out in front. Bend your trunk forward, hold your big toe and pull it towards you. Exhale and bend trunk lower till your head rests on your knees. Remain in this asana for 5 seconds and gradually increase the time. Paschimottanasana stretches the spine, shoulders and leg muscles. It massages the internal organs, especially the digestive organs. It is not recommended for people suffering from hernia, spondylitis and chronic constipation. Ustrasana. For the next technique, Ustrasana, stand on your knees. Slowly push your buttocks forward, arching your back. Take your both arms back and hold your heels. Slowly lift your head up. When you get to the final posture, take normal breaths and hold. Come back slowly, releasing your hands from the heels and relax in Vajrasana. This pose is very useful for relieving back and neck pain, and it reduces fat on the stomach and waist. Niralambasana. Sit in Dandasana. Place your hands behind your hips, fingers pointing backwards. With your legs straight and toes pointing out, Lift your body off the ground, pushing your hips up as high as possible. Ideally, your torso should be parallel to the floor. Hold the posture 10-30 seconds. As you exhale, sit down in the starting position. Nirulambasana strengthens the arms, legs, ankles, wrists, the pelvic and back muscles. Rejuvenates the spine, relieves back strain and intensely stretches the abdomen. Ekapada Rajakapatasana. Sit in Vajrasana. Stretch the right leg backwards. Place your hands on the ground under the shoulders and bend backwards. Bend your right leg, grab the foot with your right hand and put it in the fold of the arm. Raise your left arm and make a finger lock. Hold it up to your capacity. Then release your hands and legs and do it with the opposite side. This asana extends flexibility of hip muscles, increases mobility of hip joints, rejuvenates lumbar and dorsal regions. This asana should not be performed if you are suffering from ankle, knee or sacroiliac injury. Ardha Matsyendrasana. Sit in Dandasana. Fold the right leg, the right heel close to the groin. Bring the left foot near the buttock and move it over the right knee, placing the foot at the outer part of the right thigh. Raise your right arm and get hold of your left foot, with the arm touching the outer side of the left shin. Twist your body to the left and place your left arm behind around your waist. Hold, then gently release step by step. Performance of this asana turns up the lower part of the stomach. It removes muscular spasm of the spine, which afflicts scoliosis, displacement of spinal discs, and backaches. It is helpful in treating enlarged and congested liver and inactive kidneys. If you suffer from stomach ulcer, hernia, neuralgia of a sciatic nerve, do not practice it. And now we will do Gomukhasana. Go means cow, Mukha means face. First sit in Dandasana. Fold your both legs and put your left leg under the right one, the left foot beside your right hip. Place the right foot near the left hip. Sit down with your buttocks between the feet. Put your palms on the soles and stretch up your back. Bend your left arm in the elbow and bring it behind your back. Raise your right arm and with the right hand fingers, catch hold of the left hand fingers. In this final pose, keep your neck, head and back straight. Look forward and breathe normally. Stay in this final position for 20-30 seconds. While returning to the starting position, first release hands, then the right and left legs. Repeat it with the opposite side. This pose cures spasm in legs and makes leg muscle elastic. The chest is well opened, the back becomes straight and the breathing improves. Shoulder joints become more agile, dorsal muscles are completely involved in the action. It removes strain from ankle joints and stretches ankle ligaments. People who have pain in the hips, knees and shoulders should not practice this asana. Parvatasana. From sitting in Dandasana, perform Padmasana, that is the lotus pose. Place your hands on the knees with Gyan Mudra. Inhaling, raise your arms above your head, palms touching each other. Stretch your body up as much as possible. Stay in the position for some time, then lower your arms and step by step return to the starting position. This asana stretches and strengthens the chest, spine and abdominal muscles, curing certain spinal problems and improving posture. It creates body awareness and concentration. Yoga Mudra in Padmasana. From Dandasana, go to Padmasana. Bring your arms behind your back, the left hand holding the right wrist. Deeply inhale and then, while exhaling, slowly bend forward. The forehead touches the floor. Remain in the posture as long as you can. And while inhaling, slowly come back. Release your arms and step by step return to the initial position. This asana stimulates all abdominal organs. Do not practice it if you suffer from hypertension and chronic headaches. Gupta Padmasana. Starting from Dandasana, perform the lotus pose. Put palms on the floor in front of you. Rise on your knees and with the help of your hands move forward. Lie down on your stomach, forehead on the ground. Make Namaskar Mudra behind your back and maintain in the posture up to your capacity. Then slowly, step by step, return from the final position. This is good for those suffering from migraines and especially who have rounded back and hip displacement. If you have cervical problems or hip, knee or shoulder injuries, do not practice it. Now we'll do Uttita Padmasana. From Dandasana, we are going into Padmasana, making Gyan Mudra on your knees. Firmly place your palms on the ground by your hips. First, lift the buttocks and then raise your legs above the floor and balance on the hands, keeping the folded legs parallel to the ground. Maintain this posture for about 10 seconds or as long as you can. While returning to the starting position, first lower yourself on the ground and stretch out the legs. Then step by step, come in the starting position. This posture is good for the intestine and the arm muscles. It also builds up great appetite. Baddha Padmasana. Sit in Padmasana. Your hands in Gyan Mudra lying on the knees. Take a few deep breaths. Then take your right arm behind your back and catch hold of your big toe of the right foot. And with the left hand fingers, grab the big toe of the left foot. Hold this posture as long as you can. Breathe normally. Then slowly release your arms, returning to Padmasana. The stiff joints of the shoulders, elbows, wrists, lower back, hips, knees, ankles and toes are stretched in this asana and become supple. Those who have pain in the hips, knees and shoulders don't practice this. Shirshasana. Sit in Vajrasana. Make a finger lock and lean your forearms on the ground. Put the top of your head between the arms on the ground, then straighten your legs and lift them up and stretch upwards. In the final position, keep your body straight. Maintain it up to 60 seconds. Breathe normally. Then bend your legs and slowly lower them, placing the feet on the ground. Sit on your feet and relax. Regular practice of Shirshasana improves blood circulation in the upper part of the body. Those who suffer from insomnia, loss of memories, weakening of life energy can recover their health. Now we'll do Shavasana. After completing all the asanas, we have to come to a very important asana called Shavasana. Comfortably lie down on your back, slowly open your legs, then move your arms aside with the palms facing upwards. Close your eyes and relax the whole body for 5-10 minutes. Keep your breathing normal and try to enjoy this relaxation. This asana helps to relax and refresh your whole body, mind and spirit. It reduces stress and gives strength to the body. After finishing relaxation, put your legs together and the arms by the sides of the body and open your eyes. With that, we've come to a very important aspect of yoga, pranayama. Pranayama, or the expansion of prana, which is essentially life energy. Once the perfect posture or asana has been attained, one can move into pranayama, including Nadi Shuddhi, Ujjayi, Sitali, Sitkari, Bastrika, and Brahmari. The body that has been made firm by asanas and cleansed by yogic kriyas is fit for the practice of pranayama. Pranayama is to be guided by an experienced yoga guru or yoga teacher. The best time for practices is the early morning and after sunset. Pranayama involves slow, deep inhalation, puraka, retention of breath, which is kumbhaka, and exhalation or rechaka. Before we do these, it is necessary to know bandhas or lock. We basically do a 3-bandha that incorporates Jalandhara bandha, which is a throat lock, Uddiyana bandha, that is abdominal lock, and Mula bandha, that is root lock. We can practice Uddiyana bandha in a standing position. Inhale deeply and put your palms on the respective thighs. Then deeply exhale and suck your stomach in and hold your breath as long as you can. This practice strengthens and rejuvenates the nerves of gastrointestinal tract. intensifies peristalsis. The Uddiyana stimulates digestive fire, turns up all the organs of abdominal cavity. It helps to remove toxins from the alimentary tract and to clean rectum. People suffering from eye or ear diseases should not try to hold the breath. Anulom Vilom Pranayama or Nadi Shuddhi is a practice that purifies the nadis or the energy channels. Sit in Padmasana with your left hand, make Gyan Mudra, and with the right hand fingers make Pranayama Mudra. Close your eyes. Slowly inhale from your left nostril. After completing inhalation, exhale from your right nostril. Breathe calmly and again inhale from your right nostril. And finally exhale from your left nostril. This is one round of simple Nadi Shodhana pranayama. This pranayama clears chronic blockages and increases vitality, lowering stress and anxiety level. Ujjayi Pranayama. Sit in Padmasana. Close your eyes. Inhale slowly, drawing air with both nostrils and contracting your vocal cords in such a way that while inhaling the touch of air experienced in the throat and some hissing sound is produced. After completing inhalation, slowly exhale. During exhalation, the chest should go inside and the abdomen should remain steady. Keep the ratio between inhalation and exhalation 1:2. This practice is good for thyroid gland and throat. It reduces stress, tension and anxiety. Also good for treating hypertension, diabetes and all psychosomatic diseases. Bhastrika. Sit in Padmasana. Inhale and exhale quickly 40 times like the bellows of the blacksmith. Constantly dilate and contract. When you practice this pranayama, a hissing sound is produced. The practitioner should start with rapid expulsions of breath following one another in rapid succession. When the required number of expulsions is finished, the final expulsion is followed by a deepest possible exhalation. Then slowly inhale through the right nostril and exhale through the left nostril. Make the ratio 1:2. It completes one round of Bhastrika. Try to practice 5 to 10 rounds. It relieves inflammation of the throat, increases gastric fire, removes diseases of the nose and chest, and eradicates asthma. It gives good appetite. This pranayama should not be practiced either by people suffering from high blood pressure or during pregnancy. Sitali. Please sit in Padmasana. Your back straight, preferably eyes closed. Roll your tongue and stick it out. Slowly inhale through the hole made by the tongue. Count to 5 while inhaling. Hold your breath for a count of 10 and exhale through the nostrils. This pranayama lowers the body temperature and reduces anxiety. Sitkari. Sit in Padmasana, open your mouth and clench your teeth together. Slightly press the tip of the tongue against the front teeth. Inhale through the mouth over the tongue with a kind of hissing sound. After filling up the lungs completely, close the mouth and exhale through both nostrils without retention. Practice Sitkari for 1 to 5 minutes, increasing the time for 1 minute each week. It reduces heat and helps in controlling thirst, hunger and sleep. It can solve problems with throat, mouth, nose and tongue. People suffering from chronic constipation should avoid practicing this pranayama. Brahmari pranayama. Comes from Brahmara, which means a black bee. Sit in Padmasana, make Shanmukhi mudra. Inhale deeply and while exhaling make a humming sound. This practice of Brahmari keeps the mind happy. It is a brilliant way to prepare for labor if you are pregnant. The resonance produces a gentle vibration in the brain cells. Remember, all forms of pranayama calm the mind by controlling the breath and enabling you to go beyond the breath into dhyana or meditation. In one sitting, you can practice 5 to 10 times of Brahmari pranayama. And with that, we've come to dhyana or meditation, the 7th stage of yoga. It allows the mind to expand or reflect on one thought. So, meditation is simply a continuous and uninterrupted flow of attentive awareness towards the object of concentration. For dhyana, you need to sit in a comfortable posture. Make Gyan Mudra. Close your eyes. Make sure that the area around you is peaceful, clean and well ventilated. When you feel that your mind is withdrawing within, when thoughts are less and the sense of calm is experienced within, stop paying attention to your breath. Just become aware of nothingness. You are now in a state of meditation or dhyana. Enjoy. It gets rid of bronchial asthma, cardiovascular diseases, anxiety, depression, headaches, hypertension, and fatigue. After finishing, slowly open your eyes. And now we'll chant the Shanti mantra.